want to do a 7-grain bread, that's fine. But some kind of complex carb that can be used in fuel. So you can use rice, you can use millet, you can use quinoa.
Well, that's protein too.
It has protein base in it, but it's not a protein fully. Now, all foods have proteins, carbs, and fats, and you look at the ratios. So quinoa predominantly is considered a grain, which is part of the complex carb. So it will have more carbs than it will protein. Where meat will have more protein than it will carbs. And things like butter and olive oil have more fat than anything else. So yes, it's going to be a blend. The idea is just trying to keep them balanced in ratios. So usually we tell people, if you eat a 2-to-1 ratio in weight of complex carbs and proteins, you're going to be okay with that glycemic index. So even if you have things like the starchy vegetables, such as carrots and yams and cauliflower, but you're having a piece of salmon with it, the protein and fat balance that out automatically.
It hasn't been my experience. I was going to say, when I eat the grains and things like that, I don't lose weight. If I do something where I cut the carbs completely, well, but I will eat vegetables. And it's my idea of a salad is every color on the planet.
Right, I agree.
But if I eat grains, I do not lose weight. It just stacks up.
Here's the question. That's not about glycemic index at that point. That could be about your sensitivity to grain. See, this notion that glycemic index. Right. Anything in complex carbs.
Yeah.
So, you have something like, okay, well, you're eating within the glycemic index control, but you're not losing weight. Okay, well, maybe that's not the reason why you have a weight problem. It could be because of sluggish thyroid. You can have a sluggish thyroid with normal blood test. It could be because of adrenal fatigue. You may be a type of blood type. And of the blood types, diet, hypo is the only one that works. There are other ones that don't work. Hypo is those who eat a paleolithic diet. They're the original blood type of humans. So basically it's animal protein and vegetables. They don't do well on brain. Then you have to look at exercise patterns. Then you have to look at the hormonal balance. I mean, I will say this. I would rather treat somebody who's got colitis than treat somebody for weight loss. I think weight loss, outside the initial 10 pounds, whatever somebody wants to lose, and they hit that block every time, that takes more work as a general rule than working with diseases a lot of the time. Because there's so many variables we don't know about yet with weight loss. For example, the number one thing that creates imbalances in the body in disease is inflammation. You had brought that up earlier. So the thing is, what causes inflammation? When you breathe, you create inflammation. When you eat, inflammation is an ongoing cycle. The question is, how do you keep it to a minimum? So then you have to look at every system of the body. You have to look at people neurologically, you have to look at people's digestion, you have to look at hormones, you have to look at elimination. It's a tough one. And all these people promise these weight loss programs. I don't know, man. I gotta tell you, and I speak to other practitioners in my field, when you get to that real serious weight loss, people want that last 10 pounds off, that's the worst. That doesn't mean there's not an answer. It just means it takes a lot more investigation than just diet and sometimes. And that's where you're all going to get stuck. Everyone's going to promise you the next big thing coming out. Right now, the big thing they're using is HCG injection. Okay. Human chorionic gonadotropin. That is the hormone that tells you if you're pregnant or not. You do a lipstick test. It's what the body produces when you become pregnant. What they have found, and there's not enough research in this yet, is that with a very strict diet, very strict. I mean, it's not a fun diet. About 500 calories a day. And subcutaneous injections every day, 6 days a week, and on the 7th day you eat like a pig, injection. I have seen women, I haven't seen many men do it, women take an enormous amount of weight they can never lose any other way. I will say, as far as weight loss, it's effective. It does, so far from what I've seen. From what I've seen, it has, longer than diet. But again, I have only been around it about a year. So what's long-term I agree is 5, 10 years. Now, what it supposedly does, and they don't know this, so please, if this is all guesswork right now, is that there's a part of That is sort of the brain's conductor. It says, here's all the stimulus from the environment, here's all the stimulus from the inside, and I have to coordinate how the body works. It supposedly resets the hypothalamus to be more effective at its job. What they're saying is, because the hypothalamus is very involved in the endocrine system, the hormonal system of the body, it gets skewed, it gets waylaid, it gets ineffective over time. It has to go into a type of